Hi, I'm here to talk to you about teenage suicide and depression. This can be a very heavy topic, so I'm very sorry for any uncomfortableness. My name is Brittany Click, and I am doing this presentation for Nursing 370 Adaptation. Teenage suicide and depression is a major problem in the United States, as 50% of mental health conditions develop before the age of 14 and 75 develop before the age of 21. The most common mental health conditions include depression, anxiety, ADHD, and substance abuse. Depression is 2 times more likely in females, but males are more likely to die from suicide attempts than females. And suicide is the 3rd leading cause of death in adolescence. Suicide rates are higher in the West, specifically in Alaska, New Mexico, Montana, possibly due to the fact that there are many Indian reservations out west. And if you actually look at the map in the Allender book, it's all of out west. It includes Colorado, Wyoming, Idaho, Arizona, Utah. So suicide rates are lowest in the Northeast. American Indian Alaska Native males are 2 to 4 times more likely than any other ethnic group to die from suicide. And girls, especially Hispanic females, are more likely to attempt suicide than boys. Hanging or suffocation methods have increased when girls attempt suicides. Decrease in gun violence has been noted with girls. As far as culture goes, Navajo Indians generally do not share their inner thoughts or feelings. There's also not a lot of touching allowed unless you sincerely know the person and are very close to them, and that is welcomed. Also, illness is seen as a disruption in harmony with nature, and a lot of people decide to run towards the sun in the morning to help gain their harmony. There's also a big stigma with gambling and substance abuse in the Indian reservations. Also, another group that is big on suicide and depression is the Hispanic population. And alcoholism is trending in the Mexican American population, as well as the Guatemalan population, but the Guatemalans also have an increase in substance abuse. So that may also lead to further depression and suicide ideation. Freud, who is more commonly known as believing in the ego and psychosexual beings, described suicide as an intrapsychic conflict that emerges when a person experiences great psychological stress. He also believed that this includes a regression into a more primitive ego state, and it increases one's hostility to society. And Erickson, who's known for life stages such as trust versus mistrust, believed that depression and suicide ideation came from those who did not navigate life stages successfully. Some important life stages for adolescents include identity versus role confusion, which is the ages 12 through 18, and intimacy versus isolation, which is the ages of 19 through 40. Some signs and symptoms include feeling persistently sad or blue, talking about suicide or being better off dead, becoming suddenly much more irritable, having a marked deterioration in school or home functioning, reporting persistent physical complaints and or making many visits to school nurses, failing to engage in previously pleasurable activities or interactions with friends, and abusing substances. However, it is to be noted that not all teenagers become combative in society and at home, and if they're only showing signs of physical symptoms and feeling sad and blue, parents may ignore these signs and just hope that things will get better for them. The adaptation theory from James and Gilliland states that a person's crisis as being sustained through maladaptive behaviors, negative thoughts, and a destructive defense mechanism. This is especially true when a person becomes depressed and towards the point of suicidal ideation. The adaptation crisis theory states that a person's crisis will recede when these maladaptive coping behaviors are changed to adaptive behaviors. This is true during therapy, which treatment is currently designed for psychotherapy, pharmacotherapy, exercise, and social support. Psychotherapy is recommended as a first-line treatment for depressed adolescents in primary care settings, but also there is the pharmacotherapy that is generally used in primary care settings. The different types of psychotherapy or treatment groups or support groups includes cognitive behavioral therapy, which deals with changing the negative attributional bias associated with major depression. And this was described as changing the viewpoint from glass half empty to glass half full. And there's also the interpersonal therapy, which focuses on the patient's relationships with themselves and their friends and their family. The current legal matters that are around for teenage suicide and depression include the Keeping All Students Safe Act, which tries to exclude isolation in schools. There's also a legal obligation for schools to report any danger to students. This includes mass shootings such as Columbine, or if the student makes threats towards the health of themselves. School districts can become liable for teenage suicide when there is foreseeability and negligence. However, this can be really hard to prove, and it's not really enforced. In loco parentis is an act where the school actually becomes the parent for the child when a parent is not around. The Kentucky Board of Nursing, Law 314.031, states that it is unlawful for any nurse, an employer of nurses, or any person having knowledge of facts to refrain from reporting to the board a nurse who is suspected of negligently or willfully acting in a manner inconsistent with the practice of nursing. This holds us accountable for reporting anyone who makes threats about their own person and life. Some political matters that have recently come about include the mental health first aid legislation. This allows communities, including tribal lands and states, to receive grants to implement mental health first aid training programs. The Garrett Lee Smith Memorial Act. This act helps prevent Suicide Prevention Resource Center, Youth Suicide Intervention and Prevention Strategy grants, and mental health and substance abuse disorder services and outreaches on campus. The 2013 National Defense Authorization Act has been a really hot topic on Facebook. It's more commonly known as the Gun Violence Act. This also provides suicide prevention, gets more money for training at yellow ribbon events. If you're not aware of yellow ribbons, it generally means a higher need for security. The Secretary of Defense also has to increase spending in legal matters towards suicide prevention. And then the Mental Health Access Act. This specifically deals with PTSD and veterans. The VA estimates that 18 veterans a day take their own life. And these veterans include those who have recently come back from war in Afghanistan and Iraq. That is all for my presentation. There is a little word search at the end. I tried to make that fun. So I hope you enjoyed it. And I'm Brittany Click. Bye.